I love this podcast. I just love him. I'm just smiling. We just had an amazing conversation with Dr. Janet Choi, who's the Chief Medical Officer of Progyny, and she's so smart, and the problems they're solving are so multidimensional and so complex, and they're generating amazing outcomes. Like it just feels like a huge victory for womankind.
Absolutely. Dr. Choi was so articulate and made an incredibly complex, basically a work benefit, seem simple, easy to attain, and accessible. I really enjoyed the gamut of fertility to, other reproductive women's health issues to menopause, and that this is the state of art when it comes to HR and work benefits at this point.
Well, we could have talked to her for days and days, but we're just going to offer to share the conversation we had. Take a listen.
Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun-Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so excited today to have our guest, Dr. Janet Choi, who's the Chief Medical Officer of Progyny, in addition to a long, long list of amazing academic and clinical accolades. Thank you so much for being here, Dr. Choi.
Thank you so much for inviting me. It's a real treat, especially after a busy Monday. I really was looking forward to this conversation with both you and Dr. Dweck. So thank you.
So I am so interested to understand what type of platform is Progyny? Is it meant for individuals to sign on to assist them and facilitate reproductive endocrinology or fertility care? Mm-hmm. Or is it for corporations? Or is it for clinicians to help their patients better access these services? Or all of the above?
Great. So it's basically all the above, and I'll go in my response, I'll explain why. So it is, thank you for asking and starting off with that question. Since my teammates and I live and breathe Progyny, we forget, we have to sort of explain. So it is, in the most general sense of terms, a benefit provider, but it does a whole lot more. And I can attest to that as a physician, having been a Progyny network provider and having taken care of patients covered by Progyny. I'll go into that in more detail. It is now celebrating its 10-year anniversary this year.
Oh, wow. Mm-hmm.
Its origin story was as a fertility family building solution when there really wasn't a great solution 10 years ago. Still isn't in many cases, but it's getting better. I think thanks to the accomplishments of what Progyny has sort of developed over the past decade and what we've learned and how we've serviced both our clients, as well as our physicians in our network and our patients that we sort of support. So it blossomed from a fertility family building solution. And the reason why it really stood out to me, to my patients, and why it stands out to our clients is it's really a very well-integrated, comprehensive solution. So it's not just credentialing providers in the network, which we do. It's not just administering benefits, which we do in a very seamless fashion to try to be mindful of the member experience as well as the provider experience. And it's not only about pharmacy integration, although that's really integral to sort of make this sort of work well. It's at the heart of the program is the Progyny Care Advocate, the PCA, that navigator for every single member, whether or not that member ends up having to seek medical care with one of our in-network providers. Every single member who engages with us is assigned their own kind of concierge expert. And these are typically, they're all employees of ours, but they're typically nurses by background, whether labor room nurses, fertility nurses, pediatric ICU nurses in the past, doulas, nutritionists, to really best support each member going through whatever health journey they're asking about and requiring support for. And so what we did is as we evolved over time, and collecting data because our employers really wanted to better understand where their healthcare dollars were going. And we were able to show that year over year, the improvements both in pregnancy outcomes and fertility treatment outcomes, but also cost containment for complications related to fertility treatments frequently, like twins and triplets. We were able to show the drop in that. We actually, over the past few years, expanded into a comprehensive women's health solution. So not replacing the carriers that have OBGYNs in their network, but saying, hey, there's a lot in the pregnancy postpartum journey that still isn't being well served. How can we best support intended parents on that pathway? And we can talk about that later if you want, as well as a topic that is near and dear to my heart. I became Menopause Society certified, but I also really have a real interest in menopause, hormones, and impact on the body, a menopause solution for members that really work and very impactful. So it's really kind of fertility family building, expanding thoughtfully based on what we built over the past 10 years into across the entire adult spectrum, women's health support, and family support.
Thank you. So let's just jump right in. You're a reproductive endocrinologist, you're an OB-GYN, steeped in women's health, you've been involved in academic settings, you've worked in other businesses. With all that experience, what was the lure to Progyny? It seems a combination of all the things you've had the opportunity to do previously.
Yeah, I think it was a real good intersection of a variety of things. One, yes, as an OBGYN and a reproductive endocrinologist, I actually really first heard about Progyny from my patients as I was taking care of them. And, truth be told, and my colleagues have heard this story before, most physicians are so busy that they don't really pay attention to what carrier a member has, a patient has they're taking care of. They just want to get them the right care, right? And oftentimes, quite honestly, insurance authorizations, things like that, are seen as obstacles, not just to the patient, but to the physician and their team trying to best support that patient. So it was eye-opening to me when I started to first see patients come through the door, and I was like, oh, this is like a different breed of patients because they're already educated and teed up. They know what they want from their fertility journey experience, whether it was because they came in the door with infertility, a recurrent pregnancy loss, or fertility preservation desires. They had already been well prepared. There was none of this haggling and quibbling and discussing cost and where could they shave and adjust their clinical care and treatments based on what they could afford outside of their benefit coverage, or if they didn't have any coverage at all, what they can sort of shave off altogether to try to make it affordable for them to have a family, right? And instead, we were able to sit down and really work in the way that I think not just myself, but my colleagues like to do is work as a team with the patient, with the couple that we're presented with, to really try to collaborate on optimizing healthcare for that person. And I found that it was easiest to do with the patients who had Progyny coverage. And it wasn't a one-off, it was patient after patient after patient, regardless of their medical needs. And so it made me notice, and further conversations with our business office also made me recognize that the claims administration authorizations were much more seamless, less fraught for the patient experience. And our nurse team also recognized those members were really well prepared for their treatment cycles if they needed treatment. So those patients were less likely to drop out.
One quick question, because I know you can tell Rachel and I are chomping at the bit to ask you so many things. Do you provide, when I refer here in Manhattan to a reproductive endocrinologist, it's mostly fertility related, right, or super complex cases of menopause mixed with medical complexities, et cetera. But do you provide like surgical intervention, the actual procedures, IVF, IUI, et cetera, or is it mostly just the navigation portion?
I love this, and I love actually going through this. So no, Progyny does not provide the medical services per se. We administer the benefits that enable providers to provide them for members or patients that they're seeing within our network. And we've created these comprehensive, they're called Smart Cycle on the fertility side and family building side, benefit structures so that both providers who are taking care of our Progyny members and members know exactly that the entire process from initial consultation. Sometimes we also offer now home testing to make it easier, because sometimes, like for instance, sperm analysis testing, ovarian reserve testing can be time consuming and it's hard to hop around. So we're offering these the opportunity for members to get that done before they see their reproductive endocrinologist if they need to. So that first visit is very meaningful, as opposed to saying, all right, once we get your test results after this visit, we'll call you, right? So we oversee the benefit administration of that to ensure that there is seamless coverage for, but we don't actually do the medical
Yeah,
services.
I mean, it's about time. We've heard for years about fertility benefits for women through their employers. And it's been very interesting for me to watch the progression of this over years, because it
Mhm.
used to be, okay, you get 5 weeks maternity leave. Now you're also going to get, surrogacy care or, artificial reproductive technology care or whatnot. And now into menopause, as benefits that are coming along with the job. So
Right.
kudos to Progyny for being doing this for 10 years, because you're
Yes.
certainly first in line.
Now,
So
our,
one of the things you had mentioned, some of your constituents, obviously the healthcare providers, as well as the patients, but your
Mhm.
business model relies on selling these benefits to employers.
Correct.
So help people understand what that means and how important that is to building a sustainable business.
So this is what was really eye-opening to me when I first started talking, in answer to your original question, Rachel, where I thought, and I think Dr. Dweck can actually attest to this too, I thought it was really the doctors and nurses in a patient's life that had the biggest impact. I didn't realize until I took a step back and started to hear more and more of my patients' stories that it was one important piece of the puzzle. But if you don't have access, if you can't afford to be able to see that doctor or get the testing or get the treatments, what's the use of having a great doctor available, right? Even if they have appointment availability. So, what I think was eye opening to me is how much impact at a healthcare outcomes level the HR heads have, whether you're a small employer or a jumbo employer, and we actually support all sizes. And to answer one of Dr. Dweck's earlier questions, we're not direct to consumer, where we work with consultant groups, carriers and employers to offer these services to employees and to other organizations members, and then help them come up after looking at their specific populations with the most thoughtful solution to support their members.
So I'm also curious about whether the in-network or in-progeny network providers have restrictions, limitations, access troubles, cost prohibitive, or limitation, caveats, because this is what I hear from my patients in
Right.
terms of their concerns about access.
So actually, that's another really terrific question. So from an access perspective, that was one of the other reasons, maybe like reason number two, that I perked up when I first started to take care of progeny patients, because there wasn't this whole pre-authorization process. There wasn't this sort of superimposed cookie cutter stepwise therapy process that every single patient and provider had to adhere to. If you're under 35, you had to prove that you weren't getting pregnant after 12 months of heterosexual intercourse. What's the same sex female couple supposed to say to that? You weren't supposed to, you didn't have to like fail 3 IUI treatments, if you're over 35 before you could access IVF, even if your partner's sperm counts were abysmally low. The nice thing about the way this is designed is it really allows the physicians to practice at the top of their education, their license, the way that they want to. Because what Progyny's design does is says, whatever is considered appropriate care for your patient, and we've gone over sort of the treatment bundles and testing bundles with our medical advisory board. Do what you think is appropriate. We don't have these sort of starting point restrictions. We do have a few utilization management policies uh,
Mm-hmm.
around later treatment options that were, again, authored and created with our medical advisory board, who are all active in network reproductive endocrinologists
Yeah,
and urologists. That makes sense.
yeah. Here's today's hot flash. Since September 2024, 42% of US employers now offer fertility benefits. This is up from 40% in 2022 and 30% in 2020. Yeah, I mean, I'm wondering about age restriction. Some of the REs that I refer to, sorry, over 45, we don't deal with
Right.
that. AMH restrictions. And for listeners, that's a blood test to test for ovarian reserve or to see how well somebody will do with ovulation stim. And then also GLP-1s, because they're really making such a huge play in these fertility space. So are there restrictions or rules around these three things?
So age restrictions, no. But this is the reason why we also credential our own providers, because we want them to try to adhere to best practice guidelines, and they do. So the American Society for Reproductive Medicine actually.
Janet, let me interrupt you for 1 second just to explain to listeners. We sometimes take it for granted with all the terminology, what credentialing means when you're talking about credentialing physicians.
So it's basically like not just saying any doctor who says they're an OB/GYN and reproductive endocrinologist is admitted to the network. Our team, and so we've gotten external organization like NCQA, and I'm gonna have to relook at the acronym for what that stands, credentialing standards. So our team actually reviews each provider before they get admitted into our network, and we review them periodically. And if they don't meet certain standards, they might be asked to leave. Otherwise, we can hold them to these network standards so we know that our members are getting access to the best quality providers. But in terms of restrictions, so no, there isn't an age or an AMH cutoff per se. With that said, you have to look at biologic reality. And so, I understand, for instance, when a provider or colleague might say, hey, this patient is 45. She knows that donor egg or adoption is the best chance for success for having adding to her family, but can't accept that mentally, psychologically. I want her to try to do an IUI treatment because it's lower cost. We'll give her some closure, might give her a tiny chance for pregnancy, then we'll move on. And to me, that makes sense. So it's not for us to dictate care at all. It's really for our vetted providers to help have that dialogue with the patient.
So many questions. I have data questions, I have practitioner questions, but one of the things that we talk about often and that Alyssa has sensitized me to, and the statistics don't lie, is the huge rate of burnout, especially among OB-GYNs. I hear about it less so in reproductive endocrinology. Do you have data that suggests providers who are in the Progyny network, because it sounds so civilized, that perhaps you have slowed down burnout, that you, in addition to providing better care, you also have happier providers?
Do you want to join our research committee? Because I think it's a great question. I do think physician burnout has been well studied and published on. I don't know if having Progyny per se has actually done anything to significantly slow the burnout rate. I do get feedback, my colleagues and I all do, from providers in our network to say that they really appreciate and actually love seeing when a Progyny patient is on their clinic schedule, because I know the process is going to be easier in terms of evaluating, taking care of the patient, working with the patient.
And then the other piece is, since you're selling to businesses that have to make money, and you're a business that also has to make money, are you managing, and can you share any improved outcomes? So, certainly with reproductive endocrinology, my understanding, never having gone through the process, is you also want to be able to promote your stats. How likely is someone to get pregnant going through your program? Are you able to measure metrics in terms of money saved, number of successful pregnancies achieved, reduction of postpartum complications, any of those?
And I would add live birth rate, because this is what the IVF clinics, more of the assembly line model. That's the way they advertise. Come to us. This is our rate of live birth.
Absolutely. So, it depends on the area of healthcare we're looking at for women and families. So when it comes to fertility, this is part of one of the many reasons why clients seek us out is since day one, part of our contractual agreements with providers and clinics is you have to report outcomes data on each and every Progyny member you take care of, whether it's insemination, which is a more basic fertility treatment, or in vitro fertilization, and report out those data points not only to the providers, which is really useful because yes, there is the Society for Assisted Reproductive Technology and the Center for Disease Control. There's a little bit of slowdown there thanks to what's going on. And clinics are obligated to, for the most part, report to the CDC their IVF data, not their IUI data though. But there's a 2-year plus time lag from the time that a clinic will enter that data to the time that it's published, So we're doing this real time and quarterly reviewing it with the providers and clinics, as well as with our clients whose employees are seeking our services, and we're able to show consistently significantly higher per IVF treatment success rates, live birth rates, as well as, as a physician, I think it's incredibly meaningful. And Rachel, you're very savvy, so you know how this feeds into maternity costs. Significant decline in multiple pregnancy rates, to the point where I think industry standards, when you look at SARI outcomes data from 2 years ago, it's actually come down a lot from like a decade ago when it was 25%, 30% multiple rates with IVF. It's down to like 6 to 7%. I believe, and this is, my team should fact check this number. I believe our book of business multiple rate was around 1.9% or so, right? And that translates to more full-term singletons, fewer preterm, premature twins, or triplets in some cases, which also then feeds into cost containment. I mean, again, the key focus is
ICU care
outcomes, right? We're looking at an upstream, right?
Yeah.
Yeah,
I
amazing.
wanted to turn this about 180 degrees right now and talk about some of the other medical issues that your Progyny, covers. Menopause, of course, being one of them.
Yeah.
And my biggest question is, the benefits offered by Progyny. Is it simply like, here's your access to a telehealth platform, you get your hormones, end of story? Or is it much more comprehensive than that? And I bring this up because some of the other issues, endometriosis and PCOS, which you have brought up, definitely fall into this realm. And I just wonder how comprehensive Progyny gets with all of this.
Can we spend like 3 hours just chatting?
Yeah.
This is great for women's health. I'm going to answer it in a little bit piecemeal. So with the menopause question, which you brought up first, now we're not just a conduit to your virtual or in person, and we're building out our in-person network as well, provider who specializes in menopause. It's again, access to your own Progyny PCA. So a nurse who is not doing care, treatment, or provisions, but educated, trained in the area of perimenopause and menopause. So
It feels a little bit like a greeter when you walk into a store,
exactly,
like someone who's just
right?
going to ease your way.
Exactly.
Yeah.
More of an expert greeter to hold your hand,
An expert greeter.
whether you need help navigating, making your first appointment, getting some symptom validation, because I've heard too many phone calls already where some OBGYN 5 years ago dismissed this member's concerns. And so she was like, I guess I had to just sort of tolerate this and not seek any treatment. And so it's basically some coaching as well around movement, diet, because things shift, metabolism shifts, weight can shift, as well as validating. And so we're doing symptom collection and scoring and validation to sort of really see, we've been showing, although about half of the members end up connecting with a provider, half kind of follow up with our PCA coaches for ongoing support. And what we're finding is for those who've stuck with us for at least a few months, there's about a 90+% reduction or improvement in their menopause symptoms, which I find really compelling. And others should find compelling too, because that should translate into, more retention. As we know, we've seen studies and stories around women sometimes seeking early retirement because they were unable to cope with their menopause, getting the right care, or sort of deferring certain big projects or promotions because of this, as well as less time doctor shopping and clinic shopping and hopping because they aren't getting connected to the right care right away. So that's menopause, right? And then when it comes to like metrics around our pregnancy program, there it's each member is assigned, and this is both for the member and if they're in a couple, their partner can access their nurse educator as well throughout the journey, integrated with a 24/7 virtual doula service as well as lactation consultant, because there have been now a number of studies. There was a great study that just came out a few months ago looking at not just the Medicaid population, but the private carrier population of patients, showing that doula care can significantly reduce not just C-section rates, but like preterm delivery and NICU admission rates, which is really compelling. And so that's where we've kind of structured a program on in terms of following and tracking outcomes there. Like how can we impact pregnancy as well as postpartum health?
And when you partner with those groups, those are not organizations or skills you build internally, those are other networks that you collaborate with or partner with?
That's a great question. And so we do have the continuous thread is every member has their own PCA team, right, of experts internally. They're all Progyny employees to help support them, whether it's through reproductive health, fertility, preconception, pregnancy, or menopause. And then, if necessary, connecting them with vetted external partners, whether it's a network of REIs, reproductive endocrinologists and urologists for fertility, menopause expert providers, NPs, MDs, and DOs, train and educate in menopause. Or for pregnancy here, we're not trying to compete with the OB/GYN networks at this point or midwives. It's really, can we connect you to a doula who's available at 2 a.m. in the morning, or a certified lactation consultant, or pelvic physical therapist to try to help you in the postpartum period.
How do you recruit providers for this? Or do they know to come to you because, that's where the access point can be a burden?
I think it's a variety of different factors. I think, again, going back to our 10-year history, I think we've built, this is well before, I wish I could take responsibility for this, but well before I joined.
Okay.
I think the teams here really have done an excellent job of standards, of building this really great network. And so we have providers oftentimes coming to us saying, how can we join your network, right? Sometimes we'll have employers saying, we really like this team of providers. Is there any way that we can sort of review them to join your network? And some of it is also our provider team outreaching potential providers in areas where there might be a care desert, where we're trying to build up more of a presence.
And we're talking about a lot of care, which is critically important, but Progyny has also been on this crazy growth trajectory. Could you just spend a minute talking about the success of the company? We talk about there are so few unicorns in women's health. Progyny's been a unicorn for quite a long time. And so what do you attribute that amazing growth? And don't you sometimes want to shout from the top of a building, like, we're a unicorn? Pay attention. We need people in this space to see the success stories, and Progyny is a success story.
So thanks for, again, this is well beyond whatever, before I joined, but, I think it is a combination of factors. I can tell you from the physician patient perspective, it's because the benefit that Progyny designed and the support systems that Progyny sort of integrated into the benefit design, translating into really great clinical outcomes, and efficient care and efficient use of care dollars, is what really matters to doctors and patients. And that's the reason why.
And to employers.
Yes, and to employers. But it's like sitting in the doctor's office, that's what really was impactful to me and eye-opening, as well as for our members, right? And I think for the employers, we were fortunate to have partnered up early on, a decade ago, with some key jumbo clients who are still with us today. And I think they appreciated the evolution and how we quickly learned and developed and perfected our program over 10 years, really kind of foundationally rooted in not just clinical outcomes, but the data reporting on the outcomes. It wasn't just, especially in an area of healthcare that's very expensive, fertility, it wasn't just member self-reported data, which can be very biased, right?
Right.
It is actually based on auth data, claims data, provider data that's shared virtually real time, that really kind of shows the impact of our benefit and how that translates to not just happier, healthier employees and families, but also pregnancies and downstream effects as well. So I think it's a combination of all those factors. There may be more that I'm missing, but yes, I do want to shout, not that just Progyny is a unicorn, but it's like, why wouldn't you want to team up with us? Because we're willing to go the extra 2,000 miles to make it work for you and your team. And here is our history, and here are results.
Amazing. Well, thank you so much for really clarifying, a very complex business and really helping people understand what the benefits are. So I'm sure some people listening will immediately go to their HR, their benefits person, and say,
yes,
are we covered by Progyny? If not, I think we should be. So wishing you continued success as you help build, manage, and treat families.
Thank you so much. This was such a delightful conversation. I really appreciate the opportunity. Thank you.
Oh, it's our pleasure. Thank you so
Seriously.
much for joining us.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.